You know the vibes. PVO, positive vibes only. FOE, family over everything. High vibrations. Hope everybody's staying focused, staying clear-minded, staying positive, shooting all negativity down, being a mastermind, mastering self. Just want to give y'all a little update on, the whole vid-19 shit and all that extraness that's going on. So here in Maryland and Baltimore, they didn't shut down all the indoor and the outdoor dining. So, they didn't, they basically going back into, where we was at a few months ago as far as with lockdown and telling people to stay in, can't come to this business or this restaurant, things like that. Shit is amping up as a lot of people, a lot of YouTubers, a lot of people had talked about a few months ago. If y'all been paying attention, y'all would have knew, or those with ears let them hear, those with eyes let them see. You should be paying attention. You shouldn't be worried about all this other stuff that's going on, except what's going on around you. That's going to help you understand and help you get to where we need to be. But with that being said, I just want to share with y'all and give y'all a little update. This is from the Baltimore Sun, article by Pamela Wood and Jeff Barker. This was on December 8th, 2020, around 6:41 p.m. yesterday. Today is December 9th. Maryland could receive coronavirus vaccine by next week. Hospital workers, nursing home residents are the first to get the shots. Doses are highly anticipated coronavirus vaccines could start arriving in Maryland as soon as next week, with the first shots reserved for hospital workers and nursing home residents and employees, state officials said Tuesday. The state's vaccination planning efforts have accelerated as multiple vaccine candidates near approval and as the infection rate and death toll from the pandemic climb. Distribution of 50,700 doses of a Pfizer vaccine could begin as soon as Monday, with 104,300 doses of a Moderna vaccine arriving a week later, Maryland Health Department officials said during a State House news conference. The initial batch of vaccines will be enough to give just the first shot. Will be enough just to give the first of two shots to about 155,000 people. Just a tiny portion of what's needed to eventually circulate 6 million Marylanders, and not enough to cover the highest priority groups. The second shot is required weeks later to achieve full efficiency, which is more than 94% of both the Pfizer and Moderna products. The state expects to receive 300,000 doses by the end of the month. Republican Governor Larry Hogan said Tuesday afternoon at the news conference. This is by far the most massive undertaking of this pandemic, Hogan said of the vaccine distribution, with vaccine production expected to ramp up in the coming weeks and months. The state is laying the groundwork for eventual mass distribution. The Maryland Department of Health issued an order Tuesday that allowed any licensed healthcare provider with proper training, including doctors, nurses, pharmacists, and paramedics, to administer the vaccine. It may be months before the general public will be able to get the vaccine as the state works through a list of priority groups, starting with healthcare workers and nursing home residents, followed by those at highest risk of complications and deaths. Essential workers, people at moderate risk of severe illness, and finally those without risk factors. Maryland has 227 nursing homes and 1,668 assisted living facilities. The state has signed them up for a federal distribution partnership through CVS and Walgreens. As any good planner would say, you prepare for the worst and hope for the best, said Dr. Jinlan Chan, the state's top public health official. The first 24 hospitals to receive the vaccine are ready to start vaccinating their workers as soon as they get the dosage, said Bob Atlas, president and CEO of the Maryland Hospital Association. Those who are most likely to come into contact with coronavirus patients will get the shots first, he said. All the state's hospitals have been preparing to receive, store, and administer the vaccine, Atlas said. Nursing homes and assisted living facilities charged with overseeing some of Maryland's most vulnerable residents will face a series of challenges as they decide who in their care to vaccinate first and where, said Joseph D'Amatos, president and CEO of the Health Facilities Association of Maryland. The massiveness of the vaccine undertaking, the limited supply of the vaccine, and the conditions on the ground in nursing homes in Maryland and around the country make it unlikely that we will see the full impact of the vaccine until March of 2021. D'Amato said yet again, the COVID-19, we're attempting to do something that's never been done before. So there are going to be bumps in the road. Eventually, the vaccine will be available to the general public at pharmacies and doctor offices, said Byron Brian Mraz, a nurse who is the chief medical officer and assistant secretary for the state health department. That's where we want it to be in the end, but we have to go through those steps, he said. And as vaccines become more and more available, it spreads out faster and faster. The prioritization of different groups was done following federal guidelines and also in hopes that by vaccinating those at highest risk of complications first, hospitals would be able to maintain enough room to treat all those who fall ill. Hospital capacities has been a key concern throughout the pandemic as beds fill with patients suffering from COVID-19, the sickness caused by coronavirus. Pay attention to what they just said. Hospitals' capacity has been a key concern throughout the pandemic as beds fill with patients suffering from COVID-19, the sickness caused by coronavirus. As of Tuesday, 1,653 people were being treated for COVID-19 in Maryland hospitals, a number that has increased dramatically in the past month. The hospitalization rate is nearing the April 30th peak of 1,711 patients during the first wave of the pandemic. Because of a lag between when people were exposed during Thanksgiving travel and when they test positive, Hogan said it will get worse next week. All of December and January looks pretty rough. Even with Hogan indicating that the pandemic will get worse while most people wait for access to the vaccines, he did not further restrict Marylanders' activities Tuesday. Most places of business, houses of worship, stores, gyms, and restaurants have capacity restrictions. Restaurants have a 10 p.m. closing time, and their dining rooms and masks are generally required in public. We're looking at the data about where the infections are coming from and what actions might help stop them, Hogan said. And so far, we've taken all the actions that we believe should be taken at this point. Local governments can institute tougher restrictions than state. And Anne Arundel County Executive Stuart Pittman said he's considering doing just that. Pittman, a Democrat, said Tuesday that his county could face more restrictions by the end of the week, as he's concerned that hospitals might soon be overloaded with patients. There remains skepticism about vaccines, and health officials are concerned about how many people might choose to not get vaccinated. A national Gallup poll conducted in late October and early November before news about the successful trials of the Pfizer and Moderna vaccines found 58% of respondents were likely to get the vaccine. The state is planning to roll out a marketing campaign to educate the public about vaccines in hopes of improving vaccine confidence. The fuck? They plan to use trusted community voices to communicate what's known about the vaccines, including possible side effects. Chan said most people did not have side effects in vaccine trials, but some had mild fever, headaches, or pain at the injection sites. So most people didn't have side effects from the vaccines trial. So they've already gave people trial runs with this, and most people didn't have side effects. But at the actual site where they're doing these testings at different areas over Maryland and the different counties, some have had mild fever, headache, or pain at these injection sites. She said additional studies will provide more clarity on the safety of the vaccines in children and whether people would need to be vaccinated annually as they do for the flu. Hogan said the state would engage at a micro level, at a micro local level, with community leaders to encourage people to get the vaccine. We've got to convince folks to do it, or else we're not going to be able to stop the spread, the governor said. Man, that Hogan is something else, man. I'll tell you. That's a whole nother video, though. Hogan and Lieutenant Governor Boyd Rutherford pledged Tuesday to receive their shots in public as soon as they're eligible to get them. Hogan is 64 and is a cancer survivor, and Rutherford is 63. So apparently, I guess, they're trying to, take the vaccine in public so people could see it. I guess so it could boost people confidence up. The fuck out of here. As the vaccine could be made mandatory for school children like vaccines for childhood diseases, Hogan said, we don't have any intention of requiring these vaccines, but we're going to do everything we can to encourage. Maryland's medical community will focus on vaccinating a diverse range of residents, including those disproportionately impacted by the pandemic, said Dr. Mohan Santha, president and CEO of the University of Maryland Medical System, during a virtual seminar the Greater Baltimore Committee hosted Tuesday morning. Though the public health crisis has exacerbated I'm sorry, family. Though the public health crisis has exacerbated existing healthcare inequalities along lines of race, ethnicity, and class, Santha said widespread vaccinations would be a first step toward remedying disparities. We should consider it a failure if those with the greatest risk are the least vaccinated, said Santha, adding that faith leaders, nonprofit groups, and the business sector will have to join the messaging campaign. Part of the challenge of mass vaccination will be overcoming the politicalization of the science, said Kevin Sowers, president of Johns Hopkins Health System and another panelist at the GBC event. He said he expects Hopkins to receive about 975 of the first available dosage, which will be distributed among the health network's 35,000 employees based on their vulnerability to the virus as well as their exposure levels. Some people will need convincing that they aren't guinea pigs in a global experiment. So they just said there's a global experiment, and then now they're trying to convince people or going to convince people that they're not guinea pigs. But yet this is a global experiment that they haven't tried it on people, but now they're trying it on people. That sounds like motherfucking guinea pigs. Anyway, that's a lot. That's a lot we have to do with the community level, he said. It just can't be done with our voice. So that was just a little article that I wanted to share with you all as far as, things that are going on. Y'all need to pay attention. Y'all need to stay in tune, stay off that social media as far as, looking at all that bullshit on there. Y'all need to get in tune with everything that's going on. Even if you don't understand it, just tune into it so you could try to receive it, try to understand it. While you wasting your time slaving in your 9 to 5, I get everybody got to pay bills and everything. But it's a lot of y'all be consumed with the social media, looking at a whole bunch of nonsense, whole bunch of bullshit on Facebook and on the gram that's not even keeping y'all really in tune with what's going on. Y'all still worried about hood bras and a nigga pulling out all his money, nigga dripping in this, nigga riding this. Nobody give a fuck about that. We at war. We been at war. They rolling this shit out, man. Y'all better wake up, man. Love y'all. Stay blessed.